Hi, everybody. It's Patricia Coughlin, and I'm going to continue today to talk about the all important phase of defense work, making sure that you've acquainted your patient with their defenses against their anxiety provoking feelings and how these defenses end up creating or at least perpetuating their presenting problems. Very often, we see patients who internalize their feelings. They swallow them, repress them, turn anger back on the self. But there are also patients who, instead of swallowing these feelings, kind of spit them out. They're a bit more explosive. They act on and discharge feelings instead of sitting with and experiencing them internally. So they might be verbally explosive, start throwing things, and even at times can be violent. So before you would press for feeling with folks like this, you have to make sure that they understand how acting, discharging, spitting out is a way of trying to get rid of feeling rather than to experience it, and that this is doing great harm to other people and then also to themselves and their relationships. This can be very difficult for people to differentiate and understand because when they're screaming and yelling and throwing things, they really think they're angry, right? And in a certain way, of course, they are, right? They've got anger running the show. And in these cases, if we look at the brain, right, the more primitive centers of the brain and the amygdala are really activated and are running the show. The neocortex is pretty shut down. And that's really what we want on board and what we need before any real therapeutic exploration of feelings can take place. So if you think about it, helping a patient reflect on a situation where they lost their temper and encouraging them to think about it and reflect on their inner experience, again, without doing anything to get rid of it. So for these folks, again, if they start raising their voice, yelling, swearing, you really want to intervene and ask them, you see what's happening here? Again, you're kind of wanting to get rid of that feeling. Let's see if you can just sit with it, experience it in the body and notice it, right? Tell me what's actually happening. We want to increase the capacity of patients to experience intense feelings without having to defend, without having to do anything to get rid of them, not swallowing and suppressing them and ending up depressed and in physical pain, and not in blurting out and acting out their anger. So this can be and needs to be quite experiential for them. And it can be quite eye-opening for people who thought either that, going to tears and so on was their anger, right? Where they fused that defense with the experience of anger, or with those folks who thought screaming, yelling, and throwing things was their anger. This is a new experience to actually feel the heat and the energy in the body, to feel that mobilization of impulse without actually acting on it. And so you helping patients do that really increases their ego-adaptive capacity. Again, it's getting the neocortex online so that they become aware of feelings in the body and be in a better position to choose how, when, where, and with whom to express those feelings instead of just impulsively acting on them. So I hope this is a helpful distinction. Get back to me and let me know if it's clear to you and how you might, again, work with patients who tend to discharge and act out on anger rather than to experience it internally and reflect on it. Okay, hope to hear from you soon. Bye bye.